Welcome, everyone. Thanks for joining our UHC webinar today. I'm Alex Houston. For those of you that don't know me, I'm the senior specialist in the benefit operations department. So do all of the escalated issues and also have the pleasure of learning about new products for anyone else. So I'm really excited about Surest today because I've been working with it for a couple of years in the large group market and excited to have it in the level funded side for small groups as well. Today we have Craig Ulrich, who is our Surest key account executive that we work with, and he's going to be talking about Surest. Then Brendan Hurt is going to talk a little more about UHC rewards and how, which used to be called Motion, and how groups can maximize those benefits. We also have Bryce Bundy on the call with us as well, who's our large group account executive, and they will all be around to answer questions as well. So let's get started, Craig.
All right, perfect. Everyone can hear me okay, hopefully? Thumbs up, perfect. All right, well, guys, thanks for taking some time here today. Like they said, I'm Craig. I'm more of a subject matter expert here, supporting multiple teams across the middle of the country. I'm actually located down in Texas. We live in Fort Worth, but I'm originally from Minnesota. Spent 20 years in the Minneapolis marketplace. My quick background with Surest is I've been at Surest almost 6 years now. So I have lived it day in and day out. I've had a Surest plan with my family, wife and 3 kids. And before coming to Surest I was on a high deductible HSA for 12 years. And we were that type of family that put money into that HSA account and then promptly spent it every single year with the kids. So being on the Surest plan is a different experience, and I would say it's a better experience. And I hope we kind of demonstrate that as we go through this today. I'm going to share my screen. We got a few slides. We'll go over exactly what Surest is and how it works. And then we'll spend some time in a demo where we'll show you exactly what the member experience is and how they navigate this plan. And I want you to walk away from this meeting today having a good understanding of exactly what Surest is, how it works, and then also, maybe give you some tips and things that work when it comes to talking to employers about this plan. How do you position this? And I think by the time we get through this, we'll be able to accomplish that. So I'm going to share my screen and we'll go quickly. And if there's questions or something doesn't make sense, throw it into the chat. I'll have the other guys monitor the chat for me. So if there's any questions that come up, we'll try to address those as we go through this. But I do try to keep it really simple and use plain language because this is the stuff that you can use when you're out there talking to employers. Okay, everyone can see my screen, I believe. So let's just start with this. Surest has been around for quite a while, actually. It was originally started in 2016. And when I came here in 2019, we had something like 12 national clients and 20,000 members. So it has grown rapidly. So we've gone over the 1,600 employers. We've this close to 1 million members. So we'll be pushing over that shortly. And the reason I tell you that is that this is a proven solution that started in, large group ASO, but now it's moved into fully insured 51 plus across the country and now level funded in that 200 to 300 space. So it continues to grow, it continues to spread. I think it's growing really for 2 reasons. Number one, you're going to see that this is a really easy to understand benefit plan for the employees. Employees and their family members can understand this health insurance plan. And then number 2, we're using the Big Choice network. Okay, so this is not a narrow network. This is not an ACO. This is choice. So all of those doctors, all those hospitals across the country, it's the largest national PPO. People want choice. You have choice on your Surest plan of who you go to see for your doctors. Okay, I always like to start this way. Try to put yourself in the shoes of employees and their family members. Every single year when they're looking at their health benefits, they have some questions, right? So when they're looking at their medical plan and trying to make a decision, they want to know, what does my plan cover? always a big question. Like, if I have a condition or, something happens to me, is it covered? They want to know what it's going to cost. Now, this is more than just the payroll deductions. They want to know, I go to the doctor, I have a procedure done, I have an office visit. I mean, what am I actually getting billed? And then they want to find, the answers in a easy to use format. Like, where do I go to find this answer? And unfortunately, they spend a lot of time going to the HR, the benefits team, and asking these questions. So Surest was really built to answer these three questions. Being on a Surest plan myself, I can tell you exactly what's covered on my plan. I can tell you exactly what it's going to cost me before I go to the doctor or have a procedure. And I got a really easy to use tool sitting right here on my phone, or I can access it on my laptop, in which I can get all of those answers. So it's almost like the Amazon experience is maybe the best way to explain it. So we've all bought something on Amazon, or pick your favorite site. I mean, it could be Discount Tires, you name it, right? We all know how to go on, look at a product, see multiple options to that product, see prices attached to that product, make a decision, click on it, read reviews, right? I mean, we all do that, and then make an educated decision if I'm going to buy something. I have a very similar experience with Surest. I can look up an office visit. I can see multiple doctors that are in network that are close to me. I can see their co-pays that are attached to them. I can click on a doctor. I can read reviews on that doctor from his own patients. And again, make an educated decision. Is this the right direction I want to go? So we will show you guys exactly how that works when we get to the demo. But just understand, we are tapping into something that every employee and family member already does, right? They know how to shop. If they've got information and prices, they can make educated decisions. So let's jump into the Surest plan. What have we done that's different? Well, number one, we got rid of deductibles and co-insurance. They're not in the plan design at all. So the Surest plans have no deductibles, they have no co-insurance. You have copays, copays for everything. We've all stood up in front of employers and talked about, trying to explain a plan and trying to explain a deductible. And we've all gotten that blank stare from the employees where like, they don't understand it, right? And why would they? They don't deal with this every day. But they can understand copays because copay is just a price. So the Surest plan is essentially an all copay plan. So if somebody came to you and said, "Hey, I've been hearing about this Surest plan, how would you explain it?" I would say it's an all copay plan that uses the Choice PPO network, and it has a built-in consumer tool. So it's truly an all copay PPO plan with built-in consumerism. So when you look over here on the right-hand side, right, we look at a sample plan design. Again, we see an out-of-pocket max, which all of your copays count towards. No deductible, no co-insurance. Don't have to explain those. Nobody's going to miss them. And you'll see that every service has, either a copay range or a stagnant copay. Things that are emergency related, stagnant copay. Doesn't matter where you go to the nearest ER, the copay is going to be the copay. Things that you can control, like office visits or MRIs, right? Or where you have a surgery, right? All those may have a copay range, right? Again, I repeat myself a lot and we'll get into the details, but on the surface, what it is truly is an all copay PPO plan with a built-in consumerism. Now, a couple of things about copays with the Surest plan. We put a lot of thought into how do we make this simple for the members, right? Even us who have been in the business forever, we don't know what things cost, right? When I was on an HSA plan, I had a visit with a doctor in which I went in and I had some issues with my foot, went in to see her. I knew she was in network. That's the only thing I knew. So I had an office visit with her, had an x-ray, and ultimately they put a cortisone shot in my big toe joint. And since I was on an HSA, about 3 weeks later, I saw the actual bill, which was almost $700, right? Again, been doing this for decades, had no idea what anything was going to cost walking in the door. On the Surest plan, it's a very different experience because we take everything that happens in that visit, everything that happens in that procedure, right? And we have one copay that we know ahead of time. So that same scenario, if I walked into her door, let's say her copay was $25, okay? I walk in the door knowing I'm paying a $25 copay. That's going to cover the office visit, the diagnostic x-ray that happened, and the cortisone shot. No surprises for me. One copay of $25. Same thing with something like surgery. Let's use that as a better example. Surgeries, if you've ever had a surgery on a traditional plan where you have deductible and coinsurance, we all know what happens. You have your surgery, then you're getting bills from the facility, from the surgeon, from the anesthesiologist, right? You get that stack of paperwork that nobody understands. And, it all reads like stereo instructions. Very different on the Surest plan. I've had surgery both on a traditional plan and on the Surest plan. On the Surest plan, it is one copay for that surgery that I know what it is ahead of time. The copay's based on the facility that I'm going to have my surgery at. And when I get my EOB after that surgery on the Surest plan, the Surest EOB is going to show me facility charges, and here's my copay. It's a facility charge, so I'm getting billed from the facility. All of the other services, surgeon fees covered 100%. Anesthesiologist covered 100%. Very simple to understand. One copay per visit, one copay for a procedure, right? So that's a huge thing in the Surest plan to make it easy. The second thing about copays is you may be asking, well, why do we have a copay range on some services, right? Why are office visits at Dr. Johnson $20, but over here at Dr. Sally, it's $40? What's the difference, right? This is where UnitedHealthcare's data comes into play. Okay, so UHC has a very long history of ranking providers. It's the same with every carrier. They're trying to get to cost and quality to measurements. And UHC's premium program, remember the two blue hearts, which has been around for almost 20 years, was a great start. Surest is really the next generation of that. So we are looking at all providers, all locations, surgery centers, hospitals. We are looking at 1,500 individual procedures, and we are ranking them based on quality metrics first. What are the outcomes, right? What are the results? And then also the costs that are attached to it. And those that are getting better results at a lower total cost of care, we assign them a high care rating and a low copay. So high care ratings get lower copays. And that lower copay is an incentive for me as a member to potentially look at that location or look at that doctor. And we will show you exactly how that gets pieced together, but you'll start to see that how care ratings that are high, have a proven track record of getting good results, are going to be priced lower. They'll have lower copays. Okay. And again, just to repeat, so we're all on the same page, the Surest plan is an all copay PPO plan. We've got this built-in consumers tool that we're going to get to here in a second. Copays are lower for the high value providers and one copay per visit, so no surprises. And the final thing before I jump into the demo is you're always going to get questions from employers wondering, well, I understand the plan, right? I get this idea, but I don't know if my members, will my employees use the tool? Will their family members engage? Again, we can see when people engage. It's kind of like Facebook, Instagram. We know what they're searching for. We know when our members are engaging, and we see high engagement, right? We're getting a good chunk of these members, not everybody, but we're getting a good chunk of them to actually put the app on their phone. We're getting them to engage, whether they're doing it on the app or even calling into our, case management and customer service team. And then maybe most importantly is this other point of when we ask our members, do you understand the plan? So actually survey them and say, do you understand this plan? We're getting really high engagement from those members that they understand the plan. Okay. Now, I'm not expecting anybody to do this. If you want to, you can feel free to grab your phone and scan the QR code and follow along. I'm going to drive a demo here. We will provide these slides as a follow-up, so you guys can do this after the fact as well. But I want you to think about this. Open enrollment meetings, employers decided, hey, I'm going to offer a Surest plan, or even not an open enrollment, even if you're just in front of a potential client who's interested in this, you could have a CFO and an HR manager grab their phone, scan a QR code, and it's going to bring them right into a demo of our Hello Surest site. And this is where they can actually test drive the plan, understand exactly how it's going to work for them before they've even enrolled in it. So this is the real eye opener and the meat of everything. So I'm going to escape out of this, guys, real quick, and I'm going to jump into this site. So if you scan that QR code or you look at that link, it's going to bring you right into a Hello Surest site. So you're going to test drive a real plan design, right? Now, very easy to navigate. Everybody understands a search box, right? And I have this set to, I'm in North Fort Worth, so I've got it set to my zip code. You can set it anywhere you want. And can I search for my doctor? Yeah, absolutely. I can easily just throw in my doctor's name and see them. But what's really unique, guys, and this is what everyone finds really valuable, is the fact that they can start searching for procedures, conditions, things that maybe have impacted their family or things that they're worried about in the future. Employees will literally go through this and say, oh, my child had a surgery 2 years ago. I know how that worked on my other plan. I want to see how it would work on this plan. Or we had a baby and I knew how much it cost on my old plan. I'd like to see how it works on this plan. This literally answers all the questions during open enrollment so they know, does this plan work for me? So let's do some personal searches here. I'm just going to start with a sinus infection, something that I battle a couple of times a year, kind of my thing. So, quick search for a sinus infection. Okay, so I searched for sinus infection. We're going to lay out here are the coverages that you have in your health plan that are related to sinus infection. Got a sinus infection? Where do I go for care? Well, I've got options, right? Virtual care, office visits, retail clinics, urgent care, emergency room. And you show price tags, copays, right? So I show them exactly what it's going to cost. And when you lay it out this way, we just see people gravitating towards that lower cost, more convenient care. I have a sinus infection. The chances of me spending $500 on an ER visit is pretty low when I've been presented with a virtual option at 0 or an office visit at 15 or even a retail clinic at 20. Again, we can see everything they make for decisions on what they're doing. We see them choosing that alternate care overwhelmingly. So if I wanted to look at a virtual visit, click on Find Providers. I'm going to see multiple, vendors available to me, all at a $0 copay. Let's say I want to do an office visit. Just click on Office Visit, starting at $15. Click on Find Providers. Now, we're going to remind them that they have virtual care available to them at a $0 copay. I'm going to see a map here that shows locations in network Choice Plus providers that are close to me. And then over here on the left-hand side, you're going to see we start listing out doctors, and we start off with that low copay, high care rating. So you see how we visually put that together, make it very easy for them to see. And if I keep scrolling down, I'm just going to see more doctors, more copays with their care ratings as I go. Now I can search by provider name if I want in the results. I can filter the results, distance, prices, specialty, right? If I wanted to see just ear, nose, and throat, I could put ear, nose, and throat in here. Very easy filters. Again, anybody who's been on a website, going to figure this out very, very quickly. Let's pick a provider. I'm just going to pick Dr. Chen here, for example. So look at some details on Dr. Chen, $15 copay, in-network. Okay, so this care rating, you guys don't have to actually explain it to a member. They just have to click on it and read. So if you want a very plain language explanation of how the care rating works, here it is, right? It's based on historical effectiveness and cost efficiency. Those that get better results have a high care rating, and we give them a lower copay. We also pump in these health grade reviews. So these are health grades. If you guys are familiar with it, I mean, you can just Google health grades. It's a third party out there. These are just their own patients, right, who are doing reviews on the doctor. So we just pump in that review. Those are always interesting to read. Again, kind of gives you a feeling for what it's like with that doctor or that doctor's office. And we include some demographics in network accepting new patients and just good information. So one thing I always mention, and this is important to know because some people will say, well, what if my member, what if my employee doesn't engage? You're not required to use this tool to access care. So if I know Dr. Chen is in the Choice Network and I'm just going to go see Dr. Chen, whether I look him up or not, it's still a $15 copay. Okay. So we do get high utilization. Like I said, we're getting, over 80% of the people to interact, but we get some people that will still just pick up the phone, call the customer service team, right? You still get a card, right? It's got Surest and UnitedHealthcare all over it. This is my card, right? You call the customer service team on the back, I can call them and say, can you look up Dr. Chen on my plan? They will. They'll tell them, yep, it's a $15 copay. So we'll meet the member where they're at. Okay, let's do another couple of quick searches to give you guys a feel for this. So let's say maybe I'm dealing with some knee pain. I'm thinking, I've been talking with my doctor, might need an MRI. Let's just use an MRI as an example. Search for MRI. We all know there's wide variances in cost in MRIs, right? So nothing new for us on the call. But I want to see a clear price. And again, I can understand exactly what it's going to cost me just by searching for MRI. So we look at MRIs as a category of care. Doesn't matter if the MRI is on your shoulder, your back, your head, pinky, right? MRI is an MRI. Click on find providers. And again, I'm going to see locations that are close to me, co-pays, prices, know exactly what I'm going to pay. My wife is probably the best example on MRIs because of her back issues. She's had a couple of MRIs over the last couple of years. I remember vividly the first place they tried to send her. She looked it up. She's like, it's a $600 copay. And she goes, there's a place that's closer to the house that's actually a $200 copay on our plan. She's like, send the order over there. So you can start to see where people can make better decisions when they see a price. Let's take it a step further. Let's say the MRI comes back and we know that it's got a bad knee, and I'm thinking, well, I might need a knee surgery. Gonna click on a knee scope. I'm thinking maybe it's an ACL repair. I see I have location starting at 1150. Now we're also going to lay out some other reminders here. As part of that knee surgery, if you go through with the knee surgery, you might need a few other things. You may need crutches, right? So show them that the crutches are $0. You might need physical therapy after the fact. See that, hey, copays are starting at $15 on physical therapy. Already had the MRI, understand that. And we also lay out some alternatives, right? So when you're talking to your doctor, they may recommend something less invasive to start off with. They may talk about physical therapy. They may be talking about a pain injection. Again, just an easy way to remind the member that there's alternate care that's going to be a low cost option for them to try versus going right to surgery. But I'm interested in the surgery locations. I want to know what my cost is. And again, I'm going to see locations starting at the 1150. And if I keep scrolling down, down, more locations starting at 1150 all the way up to 2450. So even if I make a terrible decision on location and I want to spend a high copay, that 2450, one thing to point out is that 2450 counts against my out-of-pocket max, but that one bad decision is not going to max out my out-of-pocket. The out-of-pocket on this plan that we're showing is a $5,000 out-of-pocket max. I would have to have multiple things happen for me to hit my out-of-pocket max, and it's designed that way. Because it's all copay, we've designed it so that it's kind of hard to hit your out-of-pocket max because we see our members staying engaged throughout the year. In fact, less than 1% of our members actually hit the out-of-pocket max. The other thing I know about these high copays is the fact that 96% of the members are going to avoid them. They will steer away working with their doctors to find some place that has a lower cost copay because they're looking at what their price is. And what's happening really behind the scenes, guys, is that we know based on outcomes and cost of care For example, in Dallas Fort Worth, this knee surgery can be from as low as $7,000 at the high quality locations that are getting the best outcomes, all the way up to over $40,000 for locations that are getting less than ideal outcomes. So $7,000 to $40,000 is a huge range. All we're doing is getting people to the locations that have a proven track record of getting the best results through that lower copay. So if I can steer away from a $40,000 surgery and come over here and have it at call it a $10,000 location that's getting better outcomes, that's how you reduce your claims cost and ultimately are being more efficient with your healthcare dollars. Let's just click on a location here real quickly, show you Bear Creek Surgery Center. $1,150 is my copay. Try to do a little description of what it is, what's included. So think about the day of surgery, right? I have a copay of $1,150. What is included in that? Well, everything that happens that day of surgery, right? You go in to have your surgery. There's facility charges, surgeon, assistant surgeon, anesthesiology, right? Everybody. And then I walk out the door. Everything that happened in that day of surgery, my portion is one copay of $1,150. Okay. Well, let's do one more search. Let's do having a baby. Always a great example. So how does maternity get covered under this plan? Very simply, again, copays. So a couple of things about maternities. All of the routine prenatal and postnatal care is covered 100%, right? So don't have to worry about all the pre or postnatal. That's covered 100%. Got the easy to read maternity benefit guide. So for those new expectant parents who want to know exactly how this is all going to work, got a great maternity benefit guide. And what they're really planning on is where are we going to deliver? Because I have a copay for the delivery. Again, find providers. You're going to see locations. And again, this becomes a very easy to use planning tool based on where your OBGYN has rights. You're going to know exactly what it's going to cost depending on where you're planning on delivering. The one question that always comes up with delivery is, well, what happens if, baby has to go to NICU? Because this copay for the delivery is covering everything that happens to mom and baby in that birth event, right? So mom goes in, she has baby, she comes home with baby 72 hours later, right? That is one big event. That's a birth event. Doesn't matter if it's a vaginal birth, a C-section, emergency C-section. When she brings baby home with her, that is considered one event. So everything that happened to mom and baby is covered by that one copay. The question is, what happens if baby has to be taken away and brought over to the NICU, which that does happen, right? They had a complication. And a NICU stay is literally another visit because they took baby away from one visit and created another visit.
I don't mind it. I mean, I can still hear.
NICU is covered by, it's an emergency, and it's just one copay. So on this plan, that copay for the NICU stay is $2,000, regardless of if you're there a week, a month, 2 months, it's one set copay. So in that scenario that we just ran through, you had a copay of $1,150 for the birth, and then we had some complications. Baby was brought to the NICU, and that entire NICU stay is one copay of $2,000. Again, on a traditional plan, you would have hit mom's deductible and out-of-pocket max. You would hit baby's deductible and out-of-pocket max in that scenario. Every scenario with the Surest plan, it does come out better. And we're able to do that because we're also directing care towards those more cost-effective, better outcome locations. Final quick search for you guys. We'll do a drug search because RX is included in these searches too. So I'm just going to do a quick search for, let's do a generic Zoloft. Okay. So you're going to notice something a little interesting here, right? So you're saying, oh, drugs as low as $1, and then you'll see the 90-day delivery. So we're going to promote the home delivery as well. But you may be going, why is that $1? So the RX, the tier one on this plan is a $10 copay. We know in reality, when you go to fill your prescription, if the cost of the drug is actually less than $10, you only get charged what the actual cost is. We have what we call real-time pricing built into the tool, right? So what does that mean is we're going to round it to the nearest dollar for those drugs, and we're going to show it by pharmacy. So when I look at this drug, I'm going to see at some pharmacies, well, $1 here at Hazlitt, $2 at Red Door, and oh, CVS is $10. So we're showing real-time pricing by pharmacy, and it's an easy way to save a few dollars on a drug depending on where you want to pick it up. Okay, it's kind of like having GoodRx built right into the tool. So we're showing what we call real-time pricing. Okay. So a couple of other things before we move on, I was always like to mention is, this is what the member sees. This is easy for them to understand, right? I mean, all we built here, guys, is a real cool search tool for an all copay PPO plan, right? A couple of questions that always come up from, brokers and even employers are, now that this is offered in level funding, what does that really look like? And to be clear, guys, these are just new plans that are available to you in your UHC level funded portfolio of plans, right? So everything that you do with UHC level funded, quoting, install, billing, claims, all of that, nothing changes. We just added a new set of plans that are available to you. So you can offer Surest plans as replacements to PPOs or alongside PPOs or alongside HSA plans, right? You just have a whole new set of plans available to you that are built to create consumerism and lower employees' cost at the same time being more efficient with our claims because we're getting them to the right providers. Okay. I haven't been able to keep track of the chat. Are there any questions or concerns or thoughts on how this works?
Yeah, there's one question. So if the drug search returns as a can't find drug, it's just saying that it's not on formulary.
Correct. Yep. So if it's not in formulary, it should come back and say, I know we are starting to show some alternatives also to some of those drugs. So it depends on what the drug search was for. Great questions. Okay. Any other
And
thoughts,
just
questions? Yeah, go ahead.
something to reiterate with all of these prices that Craig's showing is that this is not on our our richest plan option with Surest either. This is our middle of the road C5000 plan demo. So it's a $5,000 out of pocket max. The copay is kind of in the middle of the road with it being the C. It kind of runs through our alphabet grading system, A being the best and the most rich benefits, all the way down to the F. Obviously, it's going to be more of the cost efficient premium wise for those groups seeking premium relief. When we're quoting these out, and what I want to stress and make sure all of you know is that when we're comparing Surest side by side with traditional level funded plans, we're not comparing apples to apples. If we're going to look at a 3,000 out of pocket max and on a traditional plan and compare it to a Surest 3,000 out of pocket max, the Surest plan is going to be much more rich because we don't have the deductible and we don't have the co-insurance. What we are trying to tell all of our brokers is that when you're quoting it out, typically $2,000 to $2,500 is what you want to quote for a higher out-of-pocket max. So that $3,000 traditional level funded plan for the out-of-pocket max, we'll want to quote the 5,000, 5,500 plans, even 6,000 plans. And the reason for that is we're not too concerned with the member actually reaching the out-of-pocket max. As Craig just showed, I mean, having a baby on this plan, for instance, I mean, we have the range from $900 to $1,700. Many people hit their out-of-pocket max in a year just by delivering a child. But with maternity, you can deliver a baby, you can have a knee scope, and you're still sitting around $2,200 on this C5000 plan versus we would have hit the out-of-pocket max on traditional. And really what we're trying to steer away from is what happens when you hit that out-of-pocket max. To me, I think, okay, time to get everything that I need done, whether it's necessary or not. I have free healthcare for the rest of this plan year. Let's go. Let's book everything. We're trying to get rid of that wasteful spending. Last year, we had over $1 trillion as a entire industry of wasteful healthcare spending. So as Surest, although we are incentivizing members to go seek the more efficient care, we're also guiding members to not go get that unnecessary care or wasteful spending that's increasing the cost to the entire industry. And then I did see a couple questions come in. So yes, this is Alicia. This is being offered to groups now. It's just think of Surest as an extension of level funding. So just like how level funding has an HSA option, just think of Surest, everything's going to be the same. So you're going to have the exact same participation rates, the exact same surplus share, the exact same applications, enrollment applications. Everything is going to be the exact same to the broker and to the employer, but the difference really is for the member. The member is going to use surest.com instead of using myuhc.com. So it is down to 2. It is not on fully insured for 2 to 50 though. It is just an extension of level funded for 2 to 50. And then talking about the myuhc piece. So since Surest is not on the myuhc.com chassis, so UHC rewards, it is not available for Surest. So completely separate. Surest is not going to be will not have UHC rewards as the value add. So those $1,000 premium rewards that they're tracking with their traditional level funded, it's just not available for level funded, unfortunately. And then also one thing to add to, Surest is not for everybody. It will not be for everybody, and we totally understand that. And it's beautiful that in 2 to 50 and also with 51 plus, we are now able to dual option plans. So you can offer an HSA side by side with a Surest plan. You can also offer high deductible health plans, although Surest really should be a great way to eliminate some of those. But we can offer just up to 15 plans and 3 Surest plans alongside, just like level funded today. When I say it's not for everybody, I mean my boss, for instance, he is a dinkwad. He's a double income, no kid with a dog. So it's just him and his wife. They have 2 great incomes. They love their HSA. They max it out. They're just pretty much accumulating more dollars into their HSA fund because they rarely do have spending. Whereas someone like me and my wife, maybe in the next year or 2, or God willing, will have a child. Well, Surest would be something that's great for us because we would try to avoid hitting the out-of-pocket max. One of my coworkers who sits across the row from me, he got back from paternity leave and had child number 2. Child number 2 on Surest cost $900. The first child that they had, not on a Surest plan, ended up costing them $11,000. So that's quite a start to a 529 account for college if you think about it that way.
There's a great question from Josh, just in case everybody didn't see it in the chat. The question was, will the copay vary by physician if you have like multiple physicians in the same location? And it does. It is individual. So when we talk about looking at that historical effectiveness and, how well are they practicing medicine, it's at the individual doctor level. So I just picked a location here that has multiple doctors, and you're going to see that each one has their own care rating and their own copay. So yes, that can vary even if you have same doctors in the same location. And it's true because not everybody practices medicine the same way. Some are better than others, right? So yes, to answer that question, there are different copays even within, because it's individualized to the doctor. So it can vary even within the same practice. That was a good question.
And Surest is also a great way too of empowering your clients to have the ability while they're sitting in the doctor's office and they've been seeing their PCP for 15, 20 years. But PCP, John, you've been seeing him for a while, figures out that, let's go get an MRI. And he's always recommended going to MRIs. He's always recommended you to Jim down the street. John and Jim go way back. They're buddies. They refer clients off of each other. It's great. Well, maybe Jim doesn't have the best success rate, or he's not the most efficient at identifying issues correctly, or maybe attributes to some of the wasteful care. That Surest allows the member to either shoot, they can literally call the number on the back of their card and get a Surest dedicated team. So I'm completely separate again from IHC. They have a Surest dedicated team that will find a efficient provider and we'll be able to help them find that appointment, get that booked. Otherwise, they're able to just pull that up simply in the app and find that. But we're trying to empower the member again to seeking the best care available to them and rewarding them for choosing the best care.
Peter,
Can you
yeah, I was
combine
going to say,
Yep.
yeah, you want to answer
So
that question?
absolutely 2 to 50. We can dual option it. So you can offer an HSA. You alongside Surest, you can offer just traditional level funding plans alongside with Surest. So like I mentioned, just think of Surest as another extension of UHC level funded. It's just another plan option. There are 14 plan designs you can either have on the Choice or Choice Plus network. But just think of it as another 28 plans with it's a copay only PPO, as Craig mentioned. Higher renewal increases compared to other plans. So 2 to 50, obviously we're just rolling it out this year. I have not seen any data yet. Maybe Amy Moore can chime in. I'm not sure if she's heard of
I can give you
anything, but
guys
2 to 50.
answers.
Perfect.
Yeah, I can give you guys answers on that. Because what we're seeing in, our ASO business, which has been around, for 8 years now, no, we are, number one, we're getting people to make different decisions, right? So they're choosing different providers. They're choosing the high quality providers that reduce your claims cost because we're reducing that waste. So for example, like in our ASO block of business, when normal trend is running 7-8% on normal trend, our trend in our ASO block is less than 5% over the last 4 years. So we've literally bent that curve. We also seeing similar things happening on our fully insured block of business, which is starting to get a couple of years under its belt as well, where it is performing the way it was designed, right? So we are lowering those overall claims costs. And I would assume we're going to see that continue again right into the level funded block of business. Guys, all we've built here is a way for you to optimize where your people are going, right? That's what we built here, is a tool that help optimize where people get care. And all they have to do is follow the app. And again, I've shown you multiple data points where they are using the tool, they are making that decision, and that does result in lower claims cost. Great question.
So are there any other questions? You can come off mute as well.
I just want to remind people that we focused a lot on Surest on a level funded basis, and that's because Surest is only available in that 2 to 50 space on a level funded basis. But when you get to groups with 51 or more eligible, then 51 to 99, it's available on a fully insured basis and level funded. And then when you get up to 100 plus, then it becomes available to also self-funded customers. So just wanted to explain that.
So I guess we can end with this. Just think of it's another extension of level funded with 2 to 50. It's a copay only PPO plan that empowers your clients to make more efficient and also a better choice when choosing healthcare. There's no other questions. I guess we can all take back like these 13 minutes. And if you do think of anything, reach out to OCI. We are all in very close contact. They're a lovely partner with us. So let them know if you do have any questions, and we'll get back to them as soon as possible and get the correct answers over to your way.
Thank you guys, and thank you everyone for being on today. Just a reminder, we do have these webinars monthly. Our June one is on June 11th at 10:30 that morning, and we'll be talking about ALEs and meeting affordability. So go ahead and mark it on your schedule. You'll be seeing a webinar blast come out from OCI, and then we'll be reaching out to you. You'll also be receiving a follow-up message for today with some attachments, some answers to any questions that we don't get. So if you have more questions, please feel free to go ahead and put them in the chat. We'll make sure we answer them and get you that information along with the recording of this webinar. So if there's something that you need to go back and listen to or reference again, you should have it. But thank you everyone for taking time out of your morning. Thank you to our great UHC partners for taking time out of your morning. This is a very exciting product. If you guys have not looked at it yet, Surest is something that could be a potential game changer and doing something very different in the market. So I do encourage you to look at it, request it from your OCI team. We are actively looking for opportunities to quote it. So if you don't request it, we see an opportunity, you might still see it on a spreadsheet. So let's reach out, let's talk about it. We'll get you information to have on hand so you can talk to your groups more effectively as well. But thank you so much. Have a wonderful rest of your day, and let us know if you need anything else. Thank you, everyone. Bye.
Thank you. Have a good day.
Thank you.
Thank you.